So as Alexander Pope put it, to err is human. And certainly that is true throughout healthcare. And even if we leave aside medical errors and patient safety, and really just focus on the financial side, as you've seen, the numbers can be so large that even small errors can be incredibly magnified, whether those are innocent errors, whether those are intentional errors. So TrueClaim comes to us from Jacksonville, and they're going to show us how true it can be that $1 billion here, $1 billion there, pretty soon you're talking real money, and what we can do about it. So please welcome TrueClaim.
So I'd be willing to bet that every person in this room has received a message or a phone call from their credit card company to verify a charge on their card. And there's a good reason for that. Improper credit card payments are a $7.1 billion problem in the United States. At the same time, I'd be willing to bet that none of you has received a message like that from your health insurance company to verify a charge on your medical bill. And yet we know that improper payments cost the healthcare industry nearly $300 billion per year. And we now know that nearly $115 billion of that is addressable by simply asking you, the patient, to weigh in, just like the credit card companies do. Now, until recently, you might have been thinking, as a patient, why should I care? This money comes out of my health plan and is largely getting picked up by my employer or my health insurance company. But increasingly, this is money that's coming directly out of your pocket. There are now 25 million of you on high deductible plans where the first $3,000, $5,000, even $12,000 in costs are your responsibility alone. Driven by ACA enrollment and the changes that employers are making to their plans across the country, this number could double to 50 million Americans on high deductible plans by 2017. What that means is that the cost of billing errors today and in the years to come are going to be hitting you, the consumer, directly. So here's how we can help. You go to see your doctor or have a healthcare encounter, and after the visit, they submit a claim. When the claim arrives at your health plan, we run it through the TrueClaim engine. We flag suspicious claims, and then we look to see if you, the patient, could tell us something about the care that you received that's material to whether the claim is correct or not. If so, we generate a set of questions for you. These are simple yes or no questions. There are never more than 4 of them, and they shouldn't take you more than 30 seconds to answer altogether. Within just a couple of days following your care, we ask you these questions through text message, voice, email, or an existing payer channel, and we collect your responses. We take those responses, we analyze them, we compare them to the details of the claim, and we reassess the validity of the charges in question. Then we deliver that assessment back to your health plan. In some cases, we're able to stop improper payments before they're made. In others, we help your health plan recover improper payments after they've already been made. But either way, you and your health plan end up with a prorated portion of the savings we generate on your medical bill. And most importantly, you and your health plan only pay for the care that you actually received. Now, because we know what was billed and we know how much ends up actually being paid, there's no ambiguity as to what the savings are. We can measure the impact of our system, and we ask for 20% of those savings from your health plan. Critically, this means that we can offer our system to health plans as a no-risk proposition and to patients at no cost. Today, well, on top of that, our early customers believe, that the communication channel that we're establishing with their members can also be used to ask other important questions. So questions like, have you considered going to a comparable in-network provider? Or do you have coverage under another health plan that we don't yet know about? Sorry, I was eager to get to this, but today we are extremely excited to announce that we're working with IBC to roll out to more than 250,000 of their members so that we can put what I just described into practice at scale. You can get excited about that. That's okay. Come on. There you go. Yeah. That's a major payer taking action, patient-centric innovation action. So, my co-founder Chris and I started this business because of the unbelievable amount of errors we were witnessing when we were building practice management and billing software for doctors and hospitals. In fact, we started this with our own family's medical bills, where over the course of 2 years, we identified tens of thousands of dollars in billing errors and generated savings for ourselves of nearly $12,000 and for our health insurance plans of 3 times that. To take the process that we were using and scale it to millions, we've been lucky enough to put together this incredible team. It's a group of people with experience from clinical practice to practice management to health and wellness platforms, consumer-facing mobile apps, advanced data analytics, claims audit, and a lot more. Over the next 18 months, we're planning to roll our system out with 5 of the largest 20 payers in the country. Accomplishing that goal will require more capital than we currently have at our disposal, so we are raising a round to make it happen. If you're interested in participating, please come find us. We'd love to talk to you. If you have connections to health plans or employers that you think could help us get this to market more quickly, we would absolutely welcome your introductions. And if all you want are some tips on how to track down the thousands of dollars in errors that could be lurking in your own medical bills, you really should come talk to us, because as I said, we only charge 20%. Thank you.